Firstly, thank you for accepting to present at the International Eurasian Conference on Biological and Chemical Sciences 1991 in Turkey. The title of our presentation is Probiotics and Prebiotics in Chronic Inflammatory Bowel Disease. Inflammatory bowel disease, including ulcerative colitis and Crohn's disease, is a type of chronic bowel inflammation disease that relapse episodes with unknown etiology. It has been widely accepted that IBD is the consequence of overly activated response of mucosal immune system to the environmental, dietary, or infectious antigen in a genetically susceptible host. In addition, the role of microflora in intestinal disorders is supported by finding that probiotics can ameliorate IBD, or use of antibiotics could benefit certain subsets of IBD patients. This knowledge has led to new therapeutic strategies that target the microflora of patients with IBD using agents such as probiotics and prebiotics, ranging from simple carbohydrates to genetically engineered bacteria with the role of secreting immunoregulatory cytokine. Prebiotics are food ingredients that selectively stimulate the growth and or activity of intestinal bacteria that have health-promoting properties for the host. Currently, the vast majority of prebiotics are non-digestible oligosaccharides, of which galacto-oligosaccharide, lactulose, inulin, and their fructo-oligosaccharide. Prebiotics can be used to alter the species composition and metabolic properties of the colonic microbiota. However, prebiotics can only affect the growth of organisms that are already in the gut, whereas probiotics are alloctons to the environment into which they are being introduced. This table represents the effect of the prebiotics on the mechanism of intestinal pathophysiology. The common effect is to reduce the pH of intraluminal pH. This low pH promotes growth of some lactic acid bacteria like bifidobacteria and lactobacilli, vs the pathogen bacteria. Also, the short-chain fatty acid production regulates colonic mucosa physiology via the production of SCFA. Some prebiotics can regulate the immune response by the secretion of some cytokine. Probiotics are viable microorganisms given a sufficient amount that reach the intestinal in active form and exert a positive health effects. The probiotic concept is effects exerted by viable microorganisms applicable independent of the site of action and route of administration, include seeds such as the oral cavity, the intestine, the vagina, and the skin. In the case of probiotic foods, the health effect is usually based on alteration of the gastrointestinal microflora and therefore based on survival during gastrointestinal transits. This table represent the effects of the probiotics on the mechanism of intestinal pathophysiology. So we have 5 most probiotics, like for example, lactobacillus can inhibit the nuclear translocation NF-kappa B. Bifidobacterium can increase in EL10 secreted by mesenteric lymph. Also, Escherichia coli can regulate the intestinal inflammation. Also, Saccharomyces can limit the infiltration of T helper 1. So we can summarize the different mechanisms for the benefits of probiotics by adherence and colonization of the gut, suppression of growth or epithelial binding, invasion by pathogenic bacteria, and production of antimicrobial substance. Also improvement of intestinal barrier function, controlled transfer of dietary antigens, and finally stimulation of mucosal and systemic host immunity. Characteristics of an ideal prebiotics. So prebiotics should not be hydrolyzed or absorbed in upper part of gastrointestinal tract. It should be a selective substrate for one or a limited number of potentially bacterial commensal to the colon culture protagonists. It should be also able to alter the colonic microflora towards a healthier composition or selectively stimulate the growth and or activity of intestinal bacteria associated with health and well-being. It should be help in increasing the absorption of certain minerals such as calcium and magnesium. It should or may have a favorable effect on the immune system and provide improved resistance against infection. So, prebiotics mechanism for health maintenance and protection against disorder is the products of prebiotics degradation are mainly short-chain fatty acids. These molecules are small enough to diffuse throughout gut, enterocyte, and enter blood circulation. Therefore, prebiotics are able to affect not only the gastrointestinal tract but also other distant seats, organs, and systems, such as the central nervous system and cardiovascular system. The use of treatment of probiotics and prebiotics in IBD is the accumulating knowledge that microbiota modulates gut physiology and immunological function in IBD described above has led scientists to investigate the effect of probiotics and prebiotics in the treatment of IBD. This therapeutic strategy aims to restore the balance of the gastrointestinal microflora in order to reduce or prevent intestinal inflammation. Although some endogenous factors such as mucin secretion can affect the microbial balance, human diet is the chief source of energy for their growth. Particularly, non-digestible carbohydrates can highly modify the composition and function of gut microbiota. Beneficial and intestinal microbes ferment this non-digestible dietary substance called prebiotics and obtain their survival energy from degrading indigestible blend of prebiotics. As a result of this, prebiotics can selectively influence gut microbiota. On the other hand, the gut microbiota affects intestinal function such as metabolism and integrity of the intestine. Moreover, they can suppress pathogens in healthy individuals through induction of some immunomodulatory molecules with antagonistic effect against pathogen by lactic acid bacteria that is produced by bifidobacterium and lactobacillus. In conclusion, in recent decades, probiotics and prebiotics have been used in a large number of experimental models of colitis and clinical trials. Experimental studies in vitro and in vivo have provided good evidence that bacterial and bacterial compounds are implicated in the pathogenic mechanisms of gut pathophysiology and that intestinal microflora play a pivotal role in the pathogenesis of IBD. So probiotics and prebiotics have demonstrated their beneficial impact in healthy subjects, both experimentally and clinically, to an equal and, in our opinion, a greater extent than in IBD patients. Probiotic and prebiotic now appear to have a pivotal role in the prevention and management of various gastrointestinal disorders that it's totally dependent on the combination of bacteria used and the type of stage of the treatment. And thank you for your attention.